America is absolutely ready to elect its first woman president, but downplayed her historic bid, saying she simply wants to turn the page for a nation exhausted by Donald Trump. With 2 weeks to Election Day, Harris and Trump are saturating swing states with rallies and taking to the airwaves and podcasts on the hunt for an advantage in a race that polls suggest is effectively tied. Speaking on the national NBC network, Harris responded absolutely when asked if America was ready to elect its first woman, but also noted her candidacy was about turning the page. People are exhausted with Donald Trump and his approach because it's all about himself, she said. Trump, speaking to supporters in North Carolina, pitched a very different message. This election is a choice between whether we will have 4 more years of incompetency, failure and disaster, or whether we will begin the 4 greatest years in the history of our country, he said to Cheers. Now moving on, world leaders called for peace in the Middle East and Ukraine at the BRICS summit in Russia on Wednesday, as President Vladimir Putin told them he welcomed offers to mediate in the Ukraine conflict. The Russian leader is casting the gathering as a sign that Western attempts to isolate Moscow have failed, but faced direct calls to end the Ukraine conflict from some of his closest and most important partners. The meeting of around 20 world leaders in the central city of Kazan is the largest diplomatic forum in Russia since Putin ordered troops into Ukraine in 2022. Starting in 2009 with 4 members, Brazil, Russia, India and China, BRICS has since expanded to include other emerging nations such as South Africa, Egypt and Iran. Chinese President Xi Jinping told the summit there must be no escalation of fighting in Ukraine. Now back to Africa. Human-caused climate change increased the intensity of seasonal rain across the Niger and Lake Chad basins this year, resulting in devastating flooding, a team of international scientists said in a study published on Wednesday. Researchers at the World Weather Attribution Initiative said floods in Chad, Cameroon, Niger, Nigeria and Sudan led to the loss of more than 2,000 lives and displaced millions of people. The rains also overwhelmed dams in Nigeria and Sudan. The WWA found that this year's rains were 5 to 20% more intense across Niger and the Lake Chad basins, which borders 4 of the 5 countries. Scientists said these spells of intense summer rainfall have become the new normal because of climate change and will occur annually if global warming continues. They added that the impact of these now common extreme floods has been exacerbated by poverty, rapid urbanization and water management issues. Well, with that, we now cross into the press review, where some papers are reporting a measles outbreak by the Ministry of Health. But Jerome Paul has more.
Well, according to the New Vision, government order on doctors sparks roar. There is part-timing in private clinics is corruption, according to the minister. Read about that. Now, Uganda records first mpox death. That is in matters health. Then in issues to do with Chitezi, members of parliament want KCCA ministers prosecuted. Read about that. As land dispute forces Muslims to jump wall for burials. Is a pictorial of that illustration. Now, caught mixed reactions as NUP supporters are jailed for 3 months. As the Wakiso fuel tanker death toll rises to 15, government to support the bereaved. More of that is in the New Vision. Now, off to the Daily Monitor. Health Ministry reports measles outbreak. Read about that as well. The pain of Chigogwa tanker inferno. In the morning, the death toll from Chigogwa fuel tank explosion has soared to 15, with more than 24 people fighting for their lives as families and traders deal with losses. The survivors relieve ordeal as health and safety experts mull solutions to the perilous road crash. Now, also, besides that, the special report why government can't patent locally made medicines, and leader of opposition asked government to probe the 550 billion Atiak sugar deal. Then in other stories, court suspends corruption trial of Trade Permanent Secretary Sally. And then also in the DM today, cars, Subaru Impreza, popular choice for Ugandans. That is in the Daily Monitor. And then lastly, from our press reviews, the Daily Nation from Kenya, standoff, Gachagua versus Parliament, says the Daily Nation. The Titanic battle, judges find DCJ has powers to appoint bench, but Mr. Rigathi's lawyers have already signaled their intention to appeal the ruling. Now, recusal of bench, ousted Deputy President's lawyers insist their application seeking the recusal of the bench for alleged bias be heard before any other matter. And then petition on lifting of conservatory order. Lawyers for Parliament and the Attorney General who want their case seeking to lift order, stopping swearing in of inferior CS Kithure Kindiki as Deputy President. Hard fast will have to wait a bit longer. Now, also missing Wells, the Fago HR director found dead. Police confirmed the body of a man recovered early yesterday in James Siaya County is that of missing Wells Fago HR boss Willis Ayeko. Then police probe drugs and sex ring angle in the murder of Kirinyanga's MCA's daughter. And grade 9 crisis to persist even as textbooks are distributed. Then also matters to do with the Social Health Insurance Fund. We don't have time to wait, patients tell President William Ruto. And that does it for our press review this morning.
Now, as we come back from the press review, in the spirit of throwing back, here is Billy Ocean, The Color of Love. We'll be right back. Right now on remand of criminal negligence charges, and now they're facing charges of manslaughter due to the incident of the landfill in Chitezi. Now, as we speak, there is a list that has been circulating on social media where it shows that over 40 people have applied and are vying for the leadership position at the Kampala Capital City Authority. Who will it be? Will it be the acting that was chosen in the interim, or it will be one of these people that are seeing themselves as the fit candidates for the position? Many questions, very few answers. But my name is Olive Monica Najima, and today we are driving this show with Jerome Paul Sonko, as Mr. Robert Chirabonyonyintono is not with us, but hopefully he will be tomorrow. Good morning, Jerome.
Good morning to you, Olive, with the shades of blue on this grateful and fateful Thursday morning. Well, here we are, and but when you mentioned something to do with the KCC executive and how things are being run in Kampala, it has taken me back to those days of Jennifer Musisi as the executive director. And of course, since it's a throwback Thursday, looking at it from the context of the current situation in Kampala, what I remember so most about Jennifer Musisi then was how aggressive she was when it came to matters development in Kampala. Of course, so many people are against how harsh some of the officials of Kampala City Council Authority used to handle certain matters. But of course, there was some serious bit of development, and unfortunately, when you go through Kampala, you realize that some of the fountains, for example, you look at some of the garbage cans that were put in place in Kampala, some of the streets that were lit up during the days of Jennifer Musisi are no more, and it is really putting the city in shambles. And then that said, that same list that has seen quite a number of former government CEOs reapplying for this post has also created room for discussion on social media. And of course, the bigger question has been, is this the rightful list that has the people who have applied for that particular position? But however, I should acknowledge the fact that when you look at some of the names that are on that list or that are applying for the role of executive director, they are serious figures, and they are characters that you cannot really rule out when it comes to a given position of that magnitude, meaning that if at all those are the people vying for that particular spot, I'm expecting a very huge tight race in regards to the interviews, and of course when it comes to who will be standing out. Will it be the current acting ED or some of those names that we saw on that particular list? And of course that list has been making rounds. However much not so many of the Ugandans have got access to it, because it does look like a list that someone set out to the public. But of course we've got to ask, why would such a list have to be
circulating
before we even have official communication from KCCA or the appointing authorities? But also from the side of Parliament, Olive, we've been having new developments coming in regards to the mergers of a few government entities back to their mother ministries. And updates coming in from Parliament is that yesterday Parliament passed the National Forestry and Tree Planting Amendment Bill of 2024. Now this will dissolve the National Forestry Authority, which is the NFA, and it will have it transferred, or the function.
Hungry for truth, a world where every story matters. There exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archive stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, every story, and every voice matters. UBC, inspiring Uganda.
Pick of the day on UBC.
He expected me to die like within the first 2 years.
Out of the blue, the child will get pains, especially in the wrists. And this happens commonly when children are starting to walk.
Was brought to you by
I'll call you every day, yeah, yo, may don't know.
You can now get all the Chibuzi out with MTN voice bundles. Call all networks, Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000, or buy any daily voice bundle of your choice. Dial *100 *21# and select daily, or use the My MTN app. When we talk together, we are unstoppable.
Hello everyone! Welcome back to Uplift Official. Today's video is particularly important as we delve into natural ways to support cancer prevention. While there's no guaranteed method to prevent cancer, incorporating certain lifestyle choices can contribute to overall well-being and potentially lower the risk. So, let's jump into the top 10 natural ways to support cancer prevention. Number 1. Maintain a healthy diet. Fill your plate with a rainbow of fruits, vegetables, whole grains, and lean proteins. These nutrient-packed foods provide antioxidants and essential nutrients that support overall health. Next up is regular exercise. Engage in activities you enjoy, whether it's walking, jogging, or dancing. Exercise not only helps maintain a healthy weight, but also boosts your immune system and promotes overall well-being. Number 3, maintain a healthy weight. Maintaining a healthy weight is crucial. Excess weight, especially around the abdomen, is linked to an increased risk of certain cancers. Aim for a balanced diet and regular physical activity to achieve and maintain a healthy weight. Number 4, quit smoking and avoid tobacco. If you're a smoker, one of the most impactful steps you can take is to quit. Smoking is a major risk factor for several cancers. Avoiding exposure to tobacco, including secondhand smoke, is equally important. Number 5, limit alcohol consumption. Moderation is key when it comes to alcohol. Limit your intake to 1 drink per day for women and up to 2 drinks per day for men. Excessive alcohol consumption is associated with an increased risk of certain cancers. Number 6, protect yourself from the sun. Protecting yourself from the sun is crucial for preventing skin cancer. Use sunscreen, wear protective clothing, and
Live from UPC Studios in Kampala, this is Good Morning Uganda.
Uganda Nurses and Midwives Union has just received around 200 kits for the hospitals, midwifery kits. These are not mama kits. I want to show you, we have we have gotten this consignment. This is a donation from Direct to Reef, our partners in America. It has 3 boxes. When you receive them, you can deliver a child from anywhere because everything is just in that kit. We have a box of instruments. We have a box of consumables. Those are things that you can use, like there are some you can use for 6 months, there are some you can use immediately. But the other instruments can even stay for 2 years, 3 years. We have also other disposable things. They are down. I want to quickly take you through some of the important things that we receive in this kit, because we usually take them to hospitals, and some of you don't take care of them very well. But this is a very important kit that helps us in safe motherhood. Now we have instruments. The way you see them, these are scissors. They are instruments used when you are delivering. Here, sometimes people get difficult when they are giving birth, and we have to do a lot of things using these instruments. Here we have receivers, we have bowels. They have also given us some of the glasses, so that if you are giving birth, I recommend all hospitals actually to buy this, because sometimes you find midwives cannot really deliver very well if if you are giving birth and maybe a mother urinates in your eyes. And at the end of the day, you have to run away and so on and clean yourself. So these are very, very important. I see them with doctors, but they're also necessary for us. I am showing you a lot of things that we received. This one is a very important instrument also, whereby you have to listen to the fetal heart of the baby once they reach in the hospital. You can also, after delivery, you can see this. This is a sucker. The babies are supposed to be sucked. This is also another thing that is very important, a thermometer. You can see these are very many thermometers, and we have received very many of them. So you can see them. They help us. They help to measure the temperature. There is also this. This is a weighing scale. Very strong. This kit costs like around 30 million. Each box can go for 10 million. And you can see how these partners have been helping us for almost now. We are going to reach almost 3 years. They have been giving us very important things. There are drugs here, very many drugs in that last box. The drugs help also during delivery. So these are things we recommend government really to give us so that we can reduce maternal child health. Syringes are also there. Giving sets are also there. We have everything here, and we are recommending government to help the midwife. We want the midwife to be safe while you're delivering. We know many of you want to help a baby and you don't want to help. A baby and a mother, you want them safe, but a midwife is also equally very important. So you can see this innovation whereby someone has packed all the things that a midwife needs. Catheters, good. These are catheters. You know, when you deliver a mother, sometimes they can get complications and they will need this. Before some of them, this helps to a mother who is getting difficult to pass urine. So you can imagine they didn't leave anything. They didn't leave anything. I cannot mention all of them, but they did not leave anything. This is for babies, like to cover the babies. So everything is here. When we reach in the hospitals, we need you to keep them safely, like we have distributed already so many health centers. Some we have been distributing these kits. I can mention some of the health centers that have actually received. In all regions, Amudat, Buko, Kazo, we have gone up to Anaka. We have gone so many areas. Nurses and Midwives Union does not only go for strikes like you think. For us, we advocate, we lobby for the nurses and midwives who are our members.
Well, thank you for sticking with us. It's important that we have conversations regarding the safety of our health workers, especially the midwives, and also safety motherhood overall. Now, according to statistics, the infant mortality rate in Uganda in 2024 is projected to be 38.015 deaths per 1,000 live births, which is a 2.9% decline from 2023, and the maternal mortality rate in Uganda is in 2022 was 189 deaths per 100,000 live births, and that was a 44% decline from 2016. Well, I'm Olive Monica Najima, and I will be speaking to a midwife to help us understand why, to help us understand, first of all, what strategies have been put in place to bring these numbers down, because as we can see, the numbers are going down compared to previous years. But also the footage you have been watching is of kits that were received from US partners, and they were received by Uganda Nurses and Midwives Union. I have their representative here with me, and we'll be delving into the conversation regarding those kits you've seen. Are they supposed to be given to individuals or health centers, and many more questions. Well, good morning and welcome to Good Morning Uganda.
Good morning. How are you?
I am okay. How are you?
I'm okay.
All right, so
I'm
now
happy to be here.
I'm glad to have you. Now, we have seen you in the footage, but for our viewer, they may want to know who you are. So please tell us, who is this beautiful lady seated next to me?
I'm called Virunj Annette. I'm a nurse, actually not a midwife, though. When you're a nurse and you have done degree in nursing, which I did, I completed degree in nursing five years ago. You do midwifery as well. You have to deliver around 20 mothers, 20 children, in order to qualify to be a degree nurse. It's a requirement.
It's a requirement.
You are not mistaken when you say nurse midwife.
Okay. Yes. And you are the General Secretary,
I'm
Uganda
the General
Nurses.
Secretary, yes, Uganda Nurses and Midwives Union, an organization that take care of the welfare of a nurse while on duty, socio-economic empowerment.
Okay.
So we are situated in, our headquarters are in Mulago. Yes, but we have our members in the whole country.
In the whole country. Now we delve into our conversation for the day. The kits that you have been showing us in that video, would like first of all to understand the partnership between Uganda Nurses and Midwives Union and the US partners, what that is involved in donating the 200 kits. What kind of partnership do you have?
For this, the organization which is currently donating these mama kits, midwifery kits, I mean, I don't want to say mama kit. Mama kit is something smaller, but it's a midwifery kit.
Yes.
And this midwifery kit is supposed to have everything that a midwife need to deliver a baby safely and also leave the mother safe. Like you have said that, you have rightly said, that the death of the children and the death of mothers today, it is decreasing, it's not increasing. So I can say these partners of ours must have contributed to that, because they came, they started giving us these kits in 2022, immediately after COVID. They have been our friends for 5 years. They have been able to give us even during COVID. They helped us so much. They are from California, and the organization is called Direct Relief. They are our partners. As a union, you are supposed to lobby to see that your members, at least they work in a safe environment. So we thank Direct Relief, but also we thank government, because when we get these kits from abroad, the government also waive off the taxes.
They waive off the taxes.
They waive off the taxes.
Okay, that's a good one, because I've always been concerned when taxes are levied on donations that are supposed to help the entire citizenry. But now, looking at the kits that you received, what is their significance, and how will they impact healthcare delivery in the country?
I will start by at least giving a brief importance of a midwife.
Okay.
Because this is the person who is supposed to use these kits.
Yes.
A midwife is a medical health provider who helps the mother during the time when the mothers, when they are pregnant, and the time when they give birth, and even after giving birth. This midwife is supposed to ensure that the baby is safe during delivery, and also the mother. Like I've rightly said it, that there is maternal child death. So when you have enough equipment to use in that delivery area, in that delivery room, honestly, the death of the children and the death of the mother, they decrease. The death, you can't have many children dying, and you cannot also have many mothers dying, because you have all the equipment. So you are actually preventing the death or any eventuality to happen. So this midwife is not God, but midwives pray a lot. Actually, we do pray a lot, because you find yourself in that room waiting for the baby. You don't know what time the baby is coming. You are just estimating, and you are also pushing. You have those labor pains, but people don't know. So you need all those equipments to make sure that the baby is delivered safely.
Safely, and that you are also safe as a midwife. Yes,
and you are also safe. So, as Uganda Nurses and Midwives Union, we know majority of the donors or even government would like to purchase things, but they will all target the safety of the baby and the safety of the mother. But for us, we protect workers. We look at workers' safety so much. So when we got these friends of ours, we explained to them that, please, you are aware that, okay, we are trying to talk to them about the death rate of the mother and the child. But they were very much concerned about, what do these midwives use do you have actually enough?
Now let's, to answer that question actually, what are the contents of the kits?
That are here, actually that's where I was coming. So we had to explain from the time when the mother comes and to the time when the baby is delivered, and the equipments that are there. We have gloves, we have both disposables, you have seen the boxes, and the boxes which are surgical gloves. We have that fetoscope, whereby you have to, when the mother comes, after putting on gloves, you have to listen to the baby, whether the baby is actually alive or not, because the mother can come when the baby is already dead. So we have the thermometers, you can see them there. Some mothers come when they are very sick, fevering and so on, so we have to measure the temperature. We have you saw also the instruments, many instruments, artery forceps, we have bisecting forceps, we have sponge holding forceps. Those, and you also have gallpots inside there, kidney dishes. So when the mother comes, you have to, when you make them lie in the position, when you're going to examine them, you have to make sure the area where you're going to, because you might wonder why those instruments are there. You have to get the sponge holding forceps, you clean. So this person who actually put this kit made sure everything is there. There is their BP machine, you will find out the blood pressure machine, the weighing scale, because when the baby is being born, after delivery, immediately you have to measure the baby to see the weight, whether the child is underweight or not. So they have everything, apron, you can see the goggles, because there is that liquor which mothers which can splash just as the mother is giving birth. It's like urine, but it's not urine. So they really made sure everything is there. And when you look at that kit, you will find that it has instruments which can stay even for like 6 years, and also disposables. When they talk about disposables, those are the ones that you can use once, or some of them you can even use for some days. Aprons are there, they have, so it has very many things, I can say. But whatever a midwife is supposed to use, even after the baby is born, like for example, a baby can get tired. You know, mothers, when they're giving birth, they get tired, and the baby can come out when they are very, they have very little oxygen, asphyxiated, and you have to measure their oxygen level. They put it there. They also put what they call arm bag, to see if someone if the baby doesn't have oxygen, what can you do immediately to give some oxygen. So they really made sure everything is there, and we've been giving these delivery kits to health centers, especially health center force, in the whole country. So in this kit, like let's say in that one box, it has kits that can serve an entire health center. Yes, it can serve like 100 mothers. 100 mothers. Yes, that's quite a big kit. That's a good one. So now, Annette, how do these kits address the current needs of nurses and midwives in Uganda, especially those in rural areas? Yes, I don't know. I would have told you this story, but you can't even believe. Sometimes you find some of the people who are responsible to buy the equipments. They can buy equipments, but they buy very few equipments. So you can find that one thermometer is being used in the whole hospital, just one. Yes. And you have, let's say, 20 mothers giving birth at the same time. Like you have so many. I remember when I was doing a degree in nursing, I did my practice in Malago. But you would find that mothers come, very many, and it's not only equipments that affect us, also the the midwives are very few and the mothers are many. But you find when people come, you are there, you're supposed to use the BP machine and the BP machine is one, but you're supposed to work very fast to make sure that all of them, you have to measure their observations. You have to know the level at how the status they are in. And you know, like I told you, you are not God, you don't know how the activities in the stomach are taking place. You don't know what is taking place. Yet you are required to actually have what they call a pathograph. And that pathograph, it is like a checklist where you have to measure I want to use the like
layman's language.
Layman's language. When the baby is coming out,
yes,
when the mother comes, you're supposed to check the centimeter.
Yes.
You use your hands, you put on gloves, and then you have to measure
to check
the dilation. So to see whether the mother is in active labor. So you find that everything you're using, they need to be available. So when they are not, when you have to share with another person, you can see what happens. The mother will be in the last stage. You can even see the baby coming out. When you're still preparing here, the baby is coming out. Another mother is crying there. So you need to be very many midwives, and you need to use very many. You have to have those enough equipments, so that some of the babies who are big, they are not going to get tired, and then you end up in theater and unnecessarily when actually you are not supposed to go to theater.
So sometimes we have
cases.
Everything. So you're saying that sometimes we have cases of mothers ending up in the theater getting cesarean sections because maybe the equipment that the nurses needed, the midwives needed, were not enough.
They are not enough. You have not done your work in time. And also, just not because you may not have enough equipment, but also you may not have, the midwives may not be enough.
So there is also the problem of fewer human resources.
Yes, few human resources, few equipments. And really those are things that we need to look at very fast, very like urgently, if you really want to reduce maternal child death. Yes.
Okay, so how will the donated items improve the workload for midwives, especially again in rural areas?
I still leave it for government for workload because I know I've been there and I saw how hard it is when you have, like for us actually by that time we were also struggling for, one would say you want to follow your baby after when you have delivered the mother, you want to follow your baby and see after delivery, are they going really to survive? So, but some of the things that, one of the reasons that I saw that was very common there, it was that delay to deliver the mothers. Like you can find that the mothers, they can come late to the hospital when they are already, maybe the babies are already tired, but also themselves, but also the human resource, when you are not many, you can find that a mother can deliver herself there from down before you put them on the delivery bed. So those are some of the things, but the equipments are very, very important because they monitor the mother and the child right away from when the mother comes until when they are discharged. But the other story which I wanted to tell you, a certain politician actually one time was trying to come from Jinja, coming to Nakasero. They had money, so they were like, we have to deliver from Kampala. And they got into their car. But you can't imagine, the mother delivered from the car. And because the man was like, I'm taking you to Kampala. But
and she was already in active labor.
Yes, and the nearest health center didn't have all the equipments. Guess what happened? I think what I remember what that politician told me was that they used the buvelas. It didn't have surgical gloves.
The nearest health center.
Yes, used the buvelas because they didn't have the what?
Surgical gloves.
The surgical gloves. And then that baby also, we followed up because he was a relative.
Yes.
They went from there, after that, of course, they had a lot of challenges. The scissors, they had the scissors.
Were they even sterilized?
No, I don't know how you have guessed. The child got serious infection and was admitted in Zambia. The baby was about to die.
A health center, was this a government health center?
Yes.
So a health center didn't have surgical gloves?
It didn't have
sterilized scissors?
Yes, it didn't have...
This is bad on all levels.
Yes, and they improvised so much. Remember, the baby also was born in that car. And they had
the car is also not sterilized.
That umbilical cord. Yes. And they were very lucky that the cord was not around the neck, because the baby was going to die. Because sometimes you can deliver a mother when the cord is around the neck. And
it needs a professional.
And it needs a professional. You have to be very fast.
Yes.
So the baby got an infection from there, and they had to rush. Remember, they are rushing. The cord is not even tied. You know what it means? So
the scissors were from the car, from the health center.
They didn't have, of course. Now you are together with your husband.
Yes.
You are in the car, and the baby has decided to come out. But you're trying to rush for these big hospitals where this health center, Kaholo hospital is not important. So things are not there. So we need to be concerned, actually,
yes,
all of us.
Bringing that into focus, the attitude of some Ugandans. Okay, in this case, the health center didn't have the resources needed to take care of this baby. But then there are others that do. So what do you think, in your perspective, needs to be done in the realm of changing attitudes of Ugandans who would rather skip a health center that is within their neighborhood to rush to, let's say, a hospital in Muyenga because that's the hospital they deem fit for their baby to be born in?
At the end of the day, I want to tell you, like I have told you, it can catch up with you. You, the Ugandan who is not concerned about that health center. Whoever is in budgeting, whoever is in control of things that are supposed to help in health, you need to know that one day, they will take your child to that nearest health center, let's say from school, and the instruments they are going to use on your child, let's say they're supposed to suture your child, maybe she has fallen down or what, or in a pitch or what, you find that those equipment that are supposed to work on your child, they are not there, and the child will bleed.
So here, who are we holding accountable? Is it us, the people that are supposed to use these health centers? Is it the government? Who is supposed to change the attitudes of Ugandans to embrace the health centers? Because we need them. I mean, I gave birth from private hospitals, but my immunization is carried out in a health center that is near home. But also, as you think on that question, Annette, for me, my main concern in health centers has always been hygiene. You walk in, the floors look extremely dirty. You walk into a room, like something is not adding up. And as a person who has come for health services, you're a bit worried. You're like, if the place is this dirty, will I trust the service?
Actually, it goes back to the human resource. I worked in a health center I worked in Chinoni Health Center but we had like one cleaner, and that cleaner had to clean everywhere. The staffs are also very few. Sometimes when you are like 3, one can get a problem. So let's say you are 3 midwives, one can get a problem, and you end up with maybe there are 2 there or 1, and that cleaning is supposed to be really, the environment must be clean if you are to think about a hospital.
That's
a hospital
right.
is one place which should be very clean, because you can come when you're not sick and you get sick from the hospital.
That's why you don't allow children.
So for me, hygiene, it is number 1, but sometimes the nurses and midwives outside, they are too busy to start with cleaning. So I think cleaning should be very, very important, and you are very right. But by the time you reach in the hospital, you find in those health centers, you find the mothers already there. Other people who did not sleep well came very early in the morning. The midwife or the nurse who stayed overnight is also very tired and actually is leaving you with the work before you even clean the place. But ideally, what we study, you are supposed to clean the environment very well. And supervision. Supervision has been a very big problem for Ministry of Health. I think also we cannot even say that, I don't know what the PS would say, whether he has enough human resource to supervise. But supervision in this country is a very big problem.
It's also lacking. Now,
yes,
Annette,
it's also
as
lacking.
we come to the end of our conversation.
There's a lot there.
Yes, and you're getting heated. But I would like to hear your last comments as we come to the end of our conversation.
Yes, my last comment, first of all, I want to tell the midwives there that the country loves them so much. They need to work and they care for the mothers, and I want to thank them for at least reducing maternal child health in this country. The midwives you see here, they deliver almost 98% of the mothers. Very few mothers are referred to go and be worked on doctors. That one I say it without even having statistics, but I know, because I know how many we refer and how many we deliver. So I want to thank them so much. I also want to thank this government, because I know you cannot reduce maternal child health when actually you don't have support for what? For government.
Yes.
But I want to, of course I have my prayers when I come here on the radio, on the TV. I want to say that the midwives, the way you have seen these delivery kits, how I wish it could be an example for the government to buy these delivery kits the way they are, and get in touch with us. We connect with Direct Reef, we see where they are made, and even if we can't buy all of them, let them be in health center for us.
Oh, thank you, Annette.
So that we can see what can help us.
Yeah, thank you, Annette. And you do raise pertinent issues here. Midwives deliver majority of the babies. I don't disagree. I've looked at the numbers in the past, and you're very right. And you do a great job. So I should thank you on behalf of all the midwives. Well, thank you so much for having spoken to us this morning, and I wish you the best of luck in your endeavors.
Oh, thank you.
Well, we've been speaking to Annette Birungi, who is the General Secretary, Uganda Nurses and Midwives Union, who received over 200 kits for midwives care. That is personal protective equipment and also other equipment that helps them while doing their job of bringing life, delivering babies. I'm Olive Najuma, and Good Morning Uganda still continues.
Live from UBC Studios in Kampala, this is Good Morning Uganda.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archived stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, every story, and every voice matters. UBC, inspiring Uganda.
Live from UBC Studios in Kampala, this is Good Morning Uganda.
See them moving behind the thick jungle leaves. This is a very individual experience, and everything depends on your luck, the terrain, and the gorilla family you'll be sent to find. You might get lucky and spend a full hour observing them. Unfortunately for us, our gorilla family decided to hide in the jungle. This is an expensive experience, but contributing to the gorilla conservation efforts in Uganda is worth it. Let's head to our last stop in Uganda, the most beautiful lake in the country, Lake Bunyoni. Traveling from Bwindi's impenetrable forest to Lake Bunyoni, everywhere you look, the mountain hills are covered with tea and coffee plantations. These enchanting landscapes are made of lush green slopes and picturesque views. The rolling mountain hills create a stunning backdrop of neatly manicured rows of tea bushes. So many scenic views. We kept asking our guide, Bob, to stop at almost every corner to take photos and take it all in. We drove to tiny villages perched on the hills. The drive to Lake Bunyoni was really beautiful. Lake Bunyoni is surely the most stunning lake in Uganda. Its winding shore and steep terraced hills surround 29 islets. We had booked a hotel on an island in the lake. The sunset boat ride to get to our hotel was serene and so relaxing. Each island in the lake has its own history and landmarks. Do you hear the sounds? This is a song of the gray-crowned crane, the national bird of Uganda. The tiny island we stayed at has several resident zebras, together with other antelopes roaming freely in the garden surrounding our hotel. Our island was lush and beautiful. It was a pleasure to walk around the property. The next morning, we got up at sunrise. One of the hotel staff had promised to show us the cranes from up close. Wow. He took us on a boat ride to approach them. These birds are truly beautiful and elegant. Lake Bunyoni is a magical place, especially early morning, when some mist is rising from its placid waters. We went for a walk around the island, among the animals that live here. This was our last day in Uganda, and frankly, we did not want to leave. Uganda surprised us with its lush green nature and the amazing red color of its soil. I was dazzled by country's biodiversity, gorgeous landscapes, and fantastic wildlife encounters. Uganda has everything to make you fall in love with its culture, its people, and its natural beauty. If you have the chance, go visit the Pearl of Africa. Uganda is worth putting on your travel list. Uganda has two main seasons, a dry season and a rainy season. The dry season is in June, July, August, December, January and February. The rainy season is in March, April, May, September, October and November. We traveled there at the beginning of April and had a fantastic time. The weather was not that rainy during our visit, and the nature around us was lush green. The occasional rainfall made the jungle come alive. These are also some of the most gorgeous sunrises I have seen in my life. At dawn, we would marvel at the magic of the blazing skies and would listen to the sounds of the jungle. Every sunrise was a symphony of joy, a canvas of wonder, and a gift to our souls. I fell in love with Uganda, and I hope I was able to share with you the essence of this beautiful country. I'm so happy to see that you've made it until the end of this video. Thank you, your support means
Well, thank you very much for watching Good Morning Uganda. I am Joram Paul Sonko, and it's now time for us to check into the world of business. Hope you're doing well. It's Thursday, quite chilly in Kampala and some neighboring areas, but that won't stop us from giving you highlights of business. Anytime is business time, so is anytime is coffee or tea time. Well, starting off with Matters Coffee is that plans to pass the National Coffee Amendment Bill 2024 have been foiled after members in the opposition in Parliament unanimously blocked the process. Now, the bill is to give effect to government process of rationalization and also allow the Uganda Coffee Development Authority a 3-year transition period to enable the Ministry of Agriculture, Animal Industries and Fisheries build capacity to execute the mandate that is under the Uganda Coffee Development Authority. Now, the transition period is a position of the NRM caucus which tasks the Ministry of Agriculture, Animal Industry and Fisheries to update Parliament annually on progress towards attainment of the requisite capacity to undertake the mandate of UCDA. Now, the Speaker of Parliament bowed to pressure from the opposition and pushed the debate to Thursday, which is today. Now, away from that, the Ministry of ICT and National Guidance encourages all the ICT stakeholders to actively engage, share expertise and collaborate on initiatives that will drive digital transformation across all sectors. Now, this call was made by the State Minister for ICT and National Guidance, Godfrey Kabyanga, at the opening of the 2-day inaugural ICT National Summit that was held in Kampala. The Information Communications Technology Association of Uganda organized the inaugural National ICT Summit to reflect on the immense potential that digital technologies hold in transforming the economy, improving service delivery at the same time, and also enhancing the quality of life for all Ugandans. Now, in his opening remarks, the Minister Kabyanga advised policymakers, innovators and academia to unite in support of Uganda's digital agenda and also help achieve the goals set out to the digital transformation roadmap, which started running last year, 2023 to 2027. Now, regarding the current use of artificial intelligence, the minister urged the public to harness it for development purposes only, stressing the need for the government to formulate regulatory policies to prevent harmful applications. Now, board chairperson Elizabeth Ntege stated that Uganda has made strides in digital transformation with at least 30 million people using mobile internet services. However, she noted that high taxes on internet access remain a significant challenge within the sector as the 2-day inaugural ICT National Summit is being held under the theme Economic Competitiveness through Strategic and Sustainable Digital Transformation, aiming to build a resilient digital economy that is inclusive, sustainable and capable of meeting future challenges. All right, now we turn our focus on the Energy Forum because a report on sustainable energy transition in the Great Lakes region has revealed that the member states have significant potential to harness and utilize the resources for development. This can be achieved through the efforts of stakeholders including Parliament, to influence policies and budget frameworks to harmonize the operations. And the report was presented to the Committee on Economic Development, Regional Integration and Natural Resources of the Forum of Parliaments, the parliaments of the member states of the International Conference of the Greater Lakes region. Now, the report was presented to the Committee on Economic Development, Region Integration, Natural Resources of the Forum of Parliaments, and at the same time with the International Conference on the Great Lakes region meeting in Kampala to discuss policies, which policies are aimed at driving development in the region. Now, key on the agenda is a discussion of the challenges and opportunities in the sustainable energy transition. Now, at the same time, the statutory meeting comprising members of the Committee on Economic Development, Regional Integration and Natural Resources, chaired by Honorable James Kaberuka, who is also the chairperson, the vice chairperson. Now, at the same time, the research on the sustainable energy transition in Great Lakes region reveals that it has abundant renewable resources and strategic mineral resources critical to region's development. Now, the report also highlighted how climate change is disproportionately affecting Africa, impacting water availability, crop yields and energy production. Now, at the same time, challenges such as limited infrastructure and grid connectivity, these reliance on biomass, the cost of development and the policy and regulatory hurdles need to be addressed. In the same spirit, the report emphasizes the critical role of parliaments in advocacy, the political will and streamlining budgeting for sustainable development. It also stresses the importance of strengthening policies and regulatory frameworks, promoting regional cooperation and investing in infrastructure and grid mobilization to facilitate the energy transition. We turn onto the forex market to see how the Ugandan shilling has been faring on the exchange. This is as all close of business yesterday. Now, starting off with the US dollar, it was buying at 3,660.23 Ugandan shillings while selling at 3,670.23. In the same spirit, by midday, the the US dollar was faring on the exchange by buying at 3,660.14 Ugandan shillings while selling at 3,670.14 shillings. Closing time saw the US dollar buying at 3,660.14, same as it was during midday, while selling was the same as it was during midday at 3,670.14. The Great Britain pound was buying at 4,756.35 while selling at 4,769.34. Looking at the euro, buying with 3,955.51 while selling with 3,966.32. The Kenyan shilling was buying at 28.37 shillings while selling at 28.45 shillings. The Tanzanian shilling was buying at 1.34 shillings while selling at 1.34 shillings. And the South African rand was buying at 209.21 shillings while selling at 209.78 shillings. These are rates that are updated 3 times daily. Now, for matters business that come to a closure this Thursday, I'll be back on Monday to give you more details from the world of business. But Saturdays at 8:30 p.m. we give you a business roundup, a wrap-up of the business reports that have made headlines throughout the week within the country and across the East African region. That said, I'll be back shortly with the latest from the USA elections. Good morning. Next month in the West, the United States will be heading to the polls, and of which we will be giving you those updates, like I did mention yesterday, in regards to the build-up of the USA 2024 elections. Now, in the latest updates coming along from the United States, shows that according to the Vice President Kamala Harris, there will be no tax rises on families earning less than $400,000 US. Now, after telling a voter that her greatest weakness is that she's kind of a nerd sometimes, Harris fielded a question from a voter about her tax policy. And Harris revealed that billionaires have a lower tax rate than teachers and firefighters, meaning the voter interrupts to say, he wants to know about hard workers who pound the street. They need to have some success, and this cannot relate to what billionaires are going through. Now, Harris revealed that billionaires are important part of her plan because Trump cut their taxes during his time as president, which she contrasts with her plan for a tax cut for the middle class. And then Harris says she will affect around 100 million people with these new changes. She retaliated by saying that her pledge is not to increase taxes on anyone making less than $400,000 a year, adding that they do not need to take seriously a system that benefits the richest and does not help out the people working in the middle income status or the middle class Americans. Now, she revealed that she's going to come from, she is coming from a middle class, and she also believes that the middle class needs tax breaks to not just get by, but to also get ahead. Now, at the same time, in the same spirit, Kamala Harris, who is also answering questions at a TV town hall event on CNN with more than 30 Pennsylvania voters who are undecided in the audience, revealed that pointing to Donald Trump, his former colleagues who have strongly criticized the former president. And Kamala Harris says that Trump, or she thinks Trump is fascist. And of course, she says that she believes that the people who know Donald Trump, based on this subject, should be trusted again. And this comes after the longest-serving chief of staff, John Kelly, told the New York Times that the former president, who is Donald Trump, once told him, you know, Hitler did some good things too, meaning he is fascist, according to Kamala Harris. Now, away from that, speaking in Georgia at his rally, Joe Biden said that the voters should lock him up, borrowing a reference from Trump's 2016 campaign. Biden corrected himself to say politically lock him up instead of lock him up. And Trump said that Biden is not legally allowed to use that, adding, it's election interference, that's all. And at her campaign events, Harris also stopped her supporters from chanting the slogan, saying that any decision to prosecute Trump should be left to politically independent prosecutors. Now, in response to being called a fascist, Donald Trump responded on his Truth social platform, writing, she's increasingly raising her rhetoric, going so far as to call me Adolf Hitler and anything else that comes to her warped mind, and terming her someone with a warped mind. Now, Trump referred to Harris as Comrade Kamala Harris, a reference to what he says her far-left policies, and described her as a threat to American democracy. Now, speaking of Donald Trump, Robert F. Kennedy Jr., who ran for president as an independent before dropping out to support Trump, spoke alongside Donald Trump in Georgia. Now, Kennedy Jr. says that the U.S. has thousands of chemicals in food which are illegal in Europe, and that Trump will remove them during his brief remarks, also pushing for the Trump agenda. Well, that does it for the updates coming in from the USA elections. Please do note that we shall be running these every day till election time to keep you up to speed with what is happening from the different campaigning teams of Kamala Harris and Donald Trump till the day of the ballot. And well, that does it for the updates this morning. Coming up is the Good Morning Uganda agenda. Stick around. Good morning.
Live from UBC Studios in Kampala, this is Good Morning Uganda.
Pick of the day on UBC.
He expected me to die like within the first 2 years.
Out of the blue, the child will get pains, especially in the wrists. And this happens commonly when children are starting to walk.
Was brought to you by
I'll call you every day, yeah, yo, baby, don't.
can now get all the chibuzi out with MTN voice bundles. Call all networks Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000 or buy any daily voice bundle of your choice. Dial *100 *21 hash and select daily or use the My MTN app. When we talk together, we are unstoppable.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archive stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, and every voice matters. UBC, inspiring Uganda.
Juko. Yo. Check the shopping, man. What's your secret?
Haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. But what you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
This week on UBC. My name's Jung Gwonjong. I'm the boss of this entire hotel. My duties include heavy lifting, spreading happiness, and driving fancy cars. I'm responsible for the area by the hotel entrance. And I officially moved into the sunroom. You think you can cut my share of the rent?
Say what?
To maximize my space, I needed to improvise a bit. That day, she walked into my life. Hi.
So, insurance, right?
Huh? Like that. I can.
Don't let him scam you. We don't want your investments or insurance.
I met the woman of my dreams.
I'll take you home. I got the Maserati.
How do you spell Maserati?
M-A-S-H.
Okay, we're leaving. You shouldn't drive, especially not in that car. The cops will fine you extra. His family's got money and don't know what to do with it.
What's your name? Huh? I'm reporting you.
If I were to be with a guy like that, I wouldn't be able to look at myself in the mirror.
Maybe all rich guys are like that. I'm not a rich guy. I'm down to earth. No, don't. It's not worth it. But after I met you, I suddenly got out of bed.
John Wonjong, I really was wrong about you. After meeting me, you learned to walk. This isn't a love story, it's a medical miracle.
And all the women in the club will be like sisters to me.
Respect is most important in a relationship. If a man doesn't respect a woman, then he's no man. Here, keep it safe. It's your playbook. Trying to be meaningful all day with them, in the end, you'll still be single with a bunch of new mom.
I was smiling all day, every day. When I woke up every morning, I wanted to yell out, "I'm so happy." If there's such thing as a miracle.
You're not a miracle. You're a maniac.
Most of the time, our lives are lackluster. When you add all the brilliant moments, or what we call miracles. Welcome.
Ladies and gentlemen, the Casita Quality Awards 2024 are on and happening on Friday the 25th of October 2024 at the IUEA Auditorium, Wonder World, Kansanga, under the theme Celebrating Excellence, Inspiring Innovation. Join us as we bring together the business community from every sector as we award them for the job well done. For more information, call 0772-590-122 or 0773-153-898 and 0781-039-451, or find us in Kampala, Uganda Market Street, Royal Complex Building, Floor 3, Suite 1. Sponsored by Deposit Protection Fund, Gentex, Tembo, Insurance Regulatory Authority, IUEA, BBS, Movit, Shria Pads, Pride Microfinance, and Jubilee Alliance.
107.3 Kampala, 96.9 Mbale, 95.7 Jinja, 98.6 Soroti. You are all covered.
UBC Butego. UBC Butego.
Live from UBC Studios in Kampala, this is Good Morning Uganda.
Well, it's very beautiful to know that you start your morning with us here on Good Morning Uganda every single day. Now it's time for our agenda, where we have topical discussions with policy makers and opinion leaders in our society. Now you've had conversations regarding uplifting the girl child and helping the girl child come or achieve her full potential. But in so doing that, we have again, education-wise to mention but a few, but as we are doing this, we have left the boy somewhere.